Kia ora everyone, I'm Sharon Cassidy and I thank you for the opportunity to present this afternoon. I won't go over my nursing roles because James has already just explained those, so I will just carry on. So as has already been mentioned, this week is Wound Awareness Week, and so today I am presenting with my New Zealand Wound Care Society hat on the Canterbury coordinator for the New Zealand Wound Care Society, and so I'm just going to really speak to you today about Wound Awareness Week, which is taking place this week. So last night we launched that with a webinar, and for those of you that didn't have the opportunity to watch it, it is available on demand for the next month on the New Zealand Wound Care Society website. And this has been endorsed by the for CPD activity by the Royal New Zealand College of Urgent Care and New Zealand College of General Practitioners. So our webinar last night was split into 7 presentations, and they're, as you see on the screen here, ACC data on burns and scalds, burn first aid, burn assessment, burn cleansing and blister management, dressing selection, referrals, and some resources. So I just want to give you a little overview of those presentations, just a slide of each, and then as I said, if you want more details you can watch it yourself on demand. So we asked ACC for some data from 2017 to 2020 on burn injuries, and so the total number, this graph here shows the total number of burn injuries in a calendar year, and ACC explained to us that you know, an injury may be active in multiple periods and it will be counted once in each period that it's active. So, for example, if someone gets a burn in 2017, it's active, but then if the treatment still carries on into 2018, it's also counted as a claim in that year. So it's very pleasing to see here that there had been a significant decrease in 2020 with burn injuries. But saying that, if you look at the cost of treatment in 2020, you'll see that that had actually increased, and we assume that that was due to inflation. It's important to point out here that the treatment costs did not include public hospitals, as this was provided by an annual service agreement between ACC and the Ministry of Health, and is funded by bulk payments from ACC to the Crown. So all the age group population showed the most cause of injury from something boiling, and so we assume that to be liquid or steam injury, either intentional or unintentional. And the second top cause identified was explosion or blasting, and the third, loss of balance and personal control. In the other category, this is anything else not identified when the ACC claim was lodged. So now, by knowing that the 2 top causes are boiling liquids and loss of balance, it's not surprising to see that most injured parts of the body is the hand or wrist, since it's just our instinct to put out our hand forward when we're trying to save ourselves from an injury. The injury diagnosis and injury sites are based on the client's primary injury. So claims may have multiple injuries, but it's the primary injury that is recorded. The most recorded injuries were in the home, and this has not changed from a publication that ACC put out in 2007. We spoke briefly about that last night. This slide here is a breakdown of the 0 to 14 age group into ethnic groups, and these age groups are reported as the most affected groups. So the European ethnic group appears to have the most claims, but to get a clearer picture, we really needed to compare this with percentage of population. And so the New Zealand latest census was in 2018, so we used that year for the percentage of population figures. You will see here that both Māori and Pacifica and the unspecified ethnic groups show the most new claims, and it's important to point out here that New Zealand's stat population figures recognise multiple ethnicities, but ACC data prioritise just one, which tends to skew the data for other and unspecified group. What's good to see here with all ethnic groups for each year, other than the unspecified, is that there has been a decrease in burn injuries. So in summary, for this part of the presentation, the 0 to 14 group is still the most affected, with the leading cause being hot substances in the home and the hand the most injured part of the body. It's good to see that claims have decreased, and we draw from this that preventative messages and campaigns do have an impact, but there's still much more work to do, not just for patient safety, but also because ACC costs continue to increase. So then our second presenter last night was Jackie Beaumont. So a lot of you up in Auckland will know Jackie as a nurse specialist in the National Burn Centre, and she spoke on burn first aid. And Jackie's, biggest message was about the importance of cooling cares for 20 minutes. And, I always tell my patients, it doesn't matter. It's not that part I want to say. I was just going to say, obviously, with our little ones under 1, we don't want to cool them too much. So we say cool running water, not cold running water, just to prevent hypothermia, because the under 1s don't have that shivering reflex. Our next speaker or presenter last night was Linda Rotas, and she is a clinical nurse educator in the burns plastic surgery unit at Hutt Valley Hospital, DHB, and she spoke on burn assessment. And she spoke about, the key components in the burn assessment is about assessing that size and that depth of the burn, and how important it is regarding the seriousness of that burn injury. The greater the surface area of the body that's burnt, then the greater risk there is to mortality. And the assessments, really determine what the health professional is going to do for that burn treatment. Deborah Murray was the next presenter, and she she's a clinical nurse specialist, as many of you will know, also for the National Burn Centre, and she presented on burn wound cleansing and blister management. And, Debbie mainly was trying to stress that cleansing is more important than the dressing that you're putting on. So, and I totally agreed with that. It could be the most expensive dressing you're putting on, but if you haven't cleaned that wound properly, you're not going to it's not going to be as effective as you would like. So it's about cleansing all and removing all that devitalised tissue before you continue. Our next presenter was Maria Tenhove, and she's a nurse educator and wound care specialist in Christchurch, and she spoke on burns dressings. And she spoke, she showed this algorithm on primary and secondary survey, stepping through the care, so identifying what the cause was, seeing if there was blisters, what the capillary refill was, and then deciding how you were going to manage that and with what sort of dressing you were going to manage it with. I'm just going to make a brief mention here. We weren't promoting any products at all last night, and I'm certainly not doing that now neither, but I did just want to mention that there has been a product that's been off the market in New Zealand for the last few months. It's Keratin products, and I was involved with a trial with 40 burn patients in 2016, and this is the published paper that I was co-author for. That product is now back on the market, so there's a new contract being signed for that, and that was very good for our burn injuries. At the time when we did the trial, the patients were assessed in ED, and then they were all followed up in the community. There was no hospital admissions with those patients. Our next speaker is David Sorrell, and he is a fellow of the Royal New Zealand College of Urgent Care, and he spoke on when and where to seek advice. And he, talked more about the criteria. He talked about where the burns regional centres were, if you needed to get your patients to a regional centre, that they were in Middlemore, Waikato. Hutt Valley and Christchurch, and then if they needed to be referred on to the National Burn Centre, that would happen via the Regional Burn Centre. And then I presented the last bit at the webinar as well, and I presented on resources and what was available for health professionals and the consumer. So the Wound Awareness Week Committee this year designed a poster on preventing burns and scalds and a trifold patient leaflet on prevention and treatment of burn injuries. So these have all been sent out to the GP practices in New Zealand, and further copies are available as PDFs on our New Zealand Wound Care Society website. So I've already had requests of those today. I'll just show you the next two. So this is the leaflet, the patient leaflet, and then the inside of that leaflet. So on prevention, burn care, and aftercare, what to do. So yes, today I've already had the fire service have actually already emailed and had attended the webinar last night, and have asked for those resources so they can use them with their education. So that's really helpful. I've actually also been into Christchurch Hospital today and helped attend to one of the children's burn dressings, and the play therapists there were really excited to see the poster and have it for their activity room and use it for education. And as I left, our ward administrator was going to put one of the posters up on the fridge in the parent tea room. So I think we are starting our education already, so it's really good. So some other resources that are also helpful from other organisations. They have lots of great information. So the New Zealand National Burn Service, of course, there's details on their site of initial assessment, care and how to make referrals. The New South Wales Trauma app can be downloaded, and that helps with treatment and calculations of burn injuries. ANZBAR, that's the Australian New Zealand Burns Association. So if you're not a member of this organisation, you are able to access all the many fact sheets that they have and download those. The Goodfellow unit has a 1-hour education course for health professionals on burn assessment and management. Safe Kids Aotearoa provides practical advice on how to keep children safe from serious injuries, and they published a document on an overview of childhood burns in Aotearoa 2020, and this is well worth a read. Wounds International have international best practice guidelines on effective skin and wound management for non-complex burns. And ACC, apart from the 2007 publication, which really does need updating, but they have just put out a guide for the outpatient on burns treatment and scar management. So that's also worth reading. Then some resources to give to our patients or tell them about. We promoted safety, that we can promote safety messages. So apart from our wound awareness patient leaflet, there's also, there's a YouTube video that Fiona Ward, a plastic surgeon from Western Australia, on safety in the bathroom, she's put together, and then there's some other New Zealand links here that we, think are good resources that you could get some information from. So because children are a high risk group for preventable injuries, we decided a good way to spread the prevention message was by contacting all New Zealand primary schools, early childhood and kohanga reo centres with an invitation through a competition to promote a safety campaign in their school. And so the competition is, it's got some prize money attached to that, and we're looking for the best campaign prevention or first aid message. And we provided them with some links and things that they could send home to the whānau to help raise further awareness. And that competition closes at the end of next week, and then the Burn Support Group is going to judge that for us. And so apart from the webinar talking about burns, I'm actually not sure that this slide should be up to date. Go on to, the webinar talking about burns and scalds. The New Zealand Wound Care Society also produce a a leaflet each year, a newsletter called The Tissue Issue, 4 times a year, and the latest one was reporting 2 case studies of burn injuries, and again that's available on the New Zealand Wound Care website if you'd like to look at that. Last week Smith and Nephew produced a podcast and had one of the plastic surgeons from Waikato Hospital and the 2 CNSs from the National Burn Service talk on burn injuries. So you can listen to that also on the website noted there. And they also spoke on brands, which is the Burns Registry for Australia and New Zealand. And ACC provides some financial support to assist with the running costs of that database, and these reports can be found on the Monash website, and again well worth a read, lots of great information in those that was being gathered. So there's some further education events taking place by local branches of the New Zealand Wound Care Society for the remainder of this week, so that's just them there. So if you'd like any more information or would like to register to go to one of those, you just go to the website and you can register there. And so I'd just like to conclude this presentation with a little plug to become a member of the New Zealand Wound Care Society if you aren't already. There's several membership plans, and it enables you to free educational events run by the Society for the year, but also reduced fees at their biannual conference. And so the next Wound Care Society conference is being held in Hamilton in September, and so again more details of that conference can be found on the New Zealand Wound Care Society website. Thank you.